In order to get a good erection, you need 5 things, okay? If any of these things go wrong, you can have erectile dysfunction. 1, you need good blood flow to your penis. What can compromise that? Smoking, vaping, heart disease. We know that actually erectile dysfunction is what we call the canary in the coal mine for heart disease, heart attack later on in life. The vessels in your penis, I don't care how big your penis are much, much smaller than those in your heart. So these are going to be blocked much earlier than the ones that are blocked in your heart. So we do know that 10 years down the line, people who have erectile dysfunction are at higher risk for having a heart attack. We also know diabetes is a risk factor for blood flow issues, high blood pressure medications. 2, you need good nerves. What can compromise your nerves? We're talking about prostate cancer, things like prostatectomy, radiation for prostate cancer. These are things that can compromise your nerves. The other thing that people don't think about a lot, diabetes. We think about diabetes. Once again, we think about your eyes, your hands, your feet. But guess what? Poorly controlled diabetes, the nerves in your penis, much smaller than the nerves everywhere else. So, it's often an early sign of poorly controlled diabetes, or a long-term diabetic, even in good conditions and treating themselves well, are at higher risk for having erectile dysfunction. 3, you need good testosterone levels, okay? Now, what can compromise testosterone levels? Diabetes, obesity, poor sleep, obstructive sleep apnea, poor diet, sedentary lifestyle. All of these things can compromise your testosterone. And we know that testosterone levels have been on the decline. There's data suggesting that younger men are having lower testosterone levels. And the next 2 are really supratentorial, right? It sounds funny, but number 4 is arousal, right? You need to be into the person you're engaging in sexual activity with. Now, believe it or not, I see a lot of guys who have relationship issues. It's hard if you're in a relationship and you're going through an argument or you're not happy with the person to get it up when you're trying to engage in sexual activity with them. So I often ask how everything is with your relationship. And oftentimes I find myself referring patients to a sexual health counselor, a sexual health therapist, a relationship therapist for these reasons alone. And then the last one is 5 is you need to be in a good state of mind. And to quote Robin Williams, he said, God gave man a brain and a penis and only enough blood to control one at a time. And he's correct. Okay. So, anxiety, depression, these things can, if you have it persistently, can increase your cortisol levels, which are decreasing your testosterone levels and really not helping you engage in sexual activity, right? You're in a high anxiety, fight or flight state. You're not trying to have sex. And unfortunately, the medications often, like the antidepressants that treat these things, can also cause erectile dysfunction, low libido, and some delayed ejaculation. So all of those things in combination with father time, time gets the best of us also. As we get older, we have a higher risk of erectile dysfunction, are reasons for erectile dysfunction.